So we're spending twice as much, we're getting far less in health. And why that's important for us is right now the difference in per capita cost for employees in a supermarket is about $5,000 per capita. And why that's important is that supermarket thing I told you about, the cinder block building, it costs about $15 million to build. And they can build that supermarket in North America, they can build that supermarket in Europe. And the problem becomes with that differential in healthcare cost, they make on that investment, it's just like a CD. They can put $15 million on the ground in Europe, and over 10 years, because that's all supermarkets will last, that investment is worth $8 million more a store to them, putting it in North America, putting it in Europe than North America because of healthcare. And what that means for us in our marketplace, and bringing it back to the United States, there are huge variations in cost across the United States. There's huge variations across the world, but in the United States, there's huge variations. The lowest cost economic regions for healthcare are the Southeast and the Southwest. Those are the fastest growing economic regions in the country. Direct linkage between healthcare costs and economic vitality. If you look at the highest healthcare cost state, Maine is one of the highest. Michigan is one of the highest. They have lost more manufacturing jobs than any other state. And all I got to do is look at the auto industry to know that healthcare is a major issue. So for us, it became economic survival for us. When I said we had those 50 stores, they just did a 50-store acquisition in Greece, Romania. We had 50 places we could build stores. In our communities, that were 10,000 jobs, that was $300 million in payroll that could have been in our communities if we'd gotten capital to grow. More importantly, for every dollar of payroll that's in a community, it generates $7 in economy. That was over $3 billion that could have gone back into the Northeast economy if we could have competed for those dollars to build supermarkets. So it's really, really important for us. We've got to get our healthcare costs down, significantly down. We think there's two places to do it. One is we think we have to reduce our healthcare costs from 50% from where they are. We think there's a 25% or 20 or half of that savings comes from keeping people healthy and well. Things that you and I choose to do around healthcare is driving 30% of the cost. It's the Big Mac for lunch. It's all those other things I did today that I shouldn't because I'm on vacation. Those are the things that are driving cost. The other side, though, is right care, right place. And for us, and our plan, like everybody else, we have a bunch of aging baby boomers. And the aging baby boomers aren't going gracefully. My whole family skis. We still think we are 18 when we ski. We're still doing slopes we shouldn't be doing. So we're doing a lot of knee replacements, hip replacements, those types of things. In our marketplace, we've been talking, Maine's got the highest hospital costs in the country. We've been talking to the hospitals saying, we need better value. And one of the things we focused on, this happened, and this tells you how fast the marketplace is changing. February 2007 in Reader's Digest, there was an article that showed for most major complex medical procedures in the US, you could go to almost any other place in the world and get them done for about a third of the cost of here. We focused on, for instance, we focused on hips, as the hips are a pretty finite procedure, well-defined. Hips in our state were costing us $50,000 a hip, if no complications. We just had a $750,000 hip because they got a staph infection. And so what we took a look at is we started looking, hips outside the US are $10,000. So we started looking, we actually went to Singapore. I was blown away. I spent a week in Singapore, and I have no clinical background. So we actually took the medical directors, the health plan we're partnered with, we got into the hospital. We got far more, we could actually get outcome information. We got information from that hospital we cannot get from our hospitals here in the US. They gave us staph infection rates, they gave us readmission rates, they gave us complication rates. They let the medical director actually go in and see surgical procedures. It is a hospital that's credentialed. We put a benefit design in place for our folks. And again, if you go back to the grocery workers, their average income is somewhere between $30,000 and $40,000 a year. We don't believe in high deductible health plans. After our folks get $2,500 out of their pocket, we pay 100%. But a hip was costing our associate about $2,500 to do. That's about 10% of their take-home pay, gross pay. 10% of their gross pay. It's just not affordable. So what we put in place is we could get hips done in Singapore for $10,000. We put a benefit design in place saying we're not taking any choices away, but if you want to go to Singapore, we'll pay 100%. So there's no money out of your pocket, and we'll also pay up to $10,000 for a companion to travel with you. And when I asked them, we didn't have a single patient that did it. We didn't think a single patient would travel. But right after we did it, we did this in January 2008, After there was a Wall Street Journal article about this little teeny supermarket chain in the Northeast that did it. It was in Health Matters, Saturday morning in the Wall Street Journal. That next week, I got a call from a hospital in Wichita, Kansas that said, you know what? We'll do all your hips, knees, and hearts for $10,000. But, I mean, we laugh, but it was the first time that it started to create a marketplace saying, and an honest conversation around, what should we do? Right after that, I got a call from another network that had about 12 US hospitals. More importantly, though, we started to get calls from our local hospitals in our communities. When I'd asked them about this, they originally said you know, we don't have to worry about value. We don't have to worry about the quality or the cost because we don't think a single patient will leave our community for care, and we don't think there's a single employer that dares move care out of our community. And it's like, that was like waving a red flag. And so we did, and one of those hospitals actually came forward and they said, we'll match that price.